Welcome, everyone. This is Dr. Mercola, and today I'm here with Dr. Hunninghake, who has been was an expert in vitamin C. He's a physician, has personally supervised over 60,000 intravenous vitamin C administrations, and really, we were fortunate to find him because he just came back from a conference that he sponsored in Japan on vitamin C. So he's really, truly is an international expert in this area, and I'm just delighted that he's able to spend some time with us today and really enlighten us about really an important modality that really, with the advent of many of these newer antioxidants and such, I think is somewhat taking a back seat. But certainly vitamin C is the grandfather of the traditional antioxidants that we know of. So welcome to our call today.
Thank you, Joe.
Can you give us a bit of a background of your professional history, how you got interested in vitamin C, and how your journey in that process has occurred and what you're doing with it now?
Well, I'm a family physician, and I've always been interested in health and wellness, and about 22 years ago joined Dr. Hugh Reardon, who after Linus Pauling and Ewan Cameron did the initial research on IV vitamin C for cancer patients, the Mayo Clinic reportedly replicated their study. Of course, they did not give it intravenously, they just gave oral vitamin C, and they were not able to get the outstanding results that Pauling and Cameron got in their study on cancer patients. And so there was a long controversy, and then Pauling died. And so Dr. Reardon pretty much took up the flag and carried on a 15-year research project called RECNAC, which is cancer spelled backwards. And he was able to do some of the initial groundbreaking research in cell culture showing that vitamin C was selectively cytotoxic against cancer cells. And so we then embarked upon a whole series of patients who had either stage 3 or stage 4 cancer, and IV vitamin C was found to be very beneficial. Now, it's not considered a standalone therapy for cancer, but it's a perfect adjunct to any kind of therapy that the cancer patient is receiving at this time, and it will reduce side effects and improve quality of life. And there's actually been 2 major studies now showing how it improves quality of life.
Interesting. I hadn't realized that you really have taken up the banner that Dr. Pauling had started, who's well recognized as really the leader and the innovator and founder of the interest in vitamin C, ascorbic acid, and that you'd really followed in his footsteps. So now, with Dr. Pauling's work, he's really known for the two points, which is really the treatment of cancer, but also the treatment of infectious diseases, specifically viral upper respiratory infections. So, do you in your work, are you primarily focusing on the use for a cancer adjuvant, or do you also use it for infections?
We use it for just about everything. Certainly, anyone that's got a cold or a flu or chronic fatigue or any chronic viral infection, we do use that. We had our first Reardon IVC and Cancer Symposium last year, and Dr. Tom Levy was our keynote speaker. And of course, Dr. Levy wrote Curing the Incurable, which is a fantastic book about vitamin C, infectious disease, and toxin control. And so certainly IV vitamin C works very well for infectious diseases as well as cancer.
Yeah, we just recently posted an article in our newsletter that something that received quite a bit of notoriety last year with the swine flu epidemic of an individual, I believe in Australia or New Zealand, who came down with terminal swine flu, was diagnosed and really given a few days or weeks to live, and I think actually contacted Dr. Levy and was given the administration IV of vitamin C and actually recovered from it quite nicely.
Yeah.
So
yeah, definitely. It's definitely a very underutilized modality in infectious disease. It's really a premier treatment for any chronic infection, but again, it's not typically recognized by conventional medicine.
Now, the vast majority of the people watching this or listening to this are not physicians. And there's really two primary ways you can administer vitamin C. One is orally, and the other is intravenously. So, obviously, uses a lot of intravenous. And if you're going to use the intravenous approach, you really have to be a healthcare clinician and licensed in some way to be trained and then certified to be able to do that. So maybe you can expand on those just different approaches for us.
Yeah, I mean, for the average patient, I'm certainly going to encourage them to continue taking at least the Linus Pauling dose, which is a 1 gram twice a day of vitamin C. Certainly, you can do more than that, and if you're suffering from chronic infections or chronic fatigue, you can go ahead and gradually increase your dose up to what's called the bowel tolerance dose, and it's very safe. The whole idea that vitamin C causes kidney stones, we have completely disproven that. I've often told patients if that were true, we would be the kidney stone capital of the world here in Wichita, Kansas, for as many IVCs as we give and as much vitamin C as we recommend. But there's been several studies by urologists that have shown that that is just simply not an issue with high-dose vitamin C. So for the typical patient, oral is fine, but if you really have a serious illness, you should think in terms of doing intravenous vitamin C from a practitioner, because it can greatly amplify and change the benefits of IV vitamin C.
Interesting. And what are the typical doses you find in intravenous vitamin C that are administered?
Well, we have, my talk over in Japan last week was the Reardon IVC protocol, and in that protocol we recommend a patient who's never had vitamin C intravenously. First of all, we recommend that people get a G6PD level. And the reason for this is that's an enzyme that the red blood cells need to maintain the integrity of their membranes. And what people don't understand is that high-dose intravenous vitamin C is a strong pro-oxidant. And a pro-oxidant in a G6PD deficient patient can cause hemolysis of their red blood cells. And so using IV vitamin C is not for just the novice. I think you should be going to an experienced practitioner who is using at least the Reardon protocol or some kind of protocol that's going to make sure that they use the vitamin C intravenously in a safe manner.
But this G6PD deficiency is relatively uncommon.
It's relatively uncommon, and quite
it's
frankly,
not something like every other person has, right?
No, you're talking more about Mediterranean descent, African descent patients, and even then it's pretty rare. I would say we did a series of over 800 G6PDs, and we only saw 4 deficiencies, okay. And of those 4, we were able to give 15-gram IV vitamin C. However, I do have knowledge that there have been practitioners who've given a 15-gram IV vitamin C, and the patient did experience hemolysis. And so from a medical legal perspective, it's best to do a G6PD before embarking upon
probably less
vitamin C.
In your experience, less than 1 person in 200, which is, so the odds are you're not going to have it, but right. To be comprehensive, you really need to do that.
Yeah.
Now, the doses that you're using is about 15 grams. You ever go higher, 25, 100?
Yeah, what the Reardon research found was that a blood level of around 300, 350 was necessary to have this selective cytotoxicity. Now, since then, we've probably geared that down a little bit, maybe even as much as 250 milligrams per deciliter is going to be sufficient to have an anti-cancer effect. Now, just to put that into perspective for the average person, if we were to measure someone off the street, their blood level would be about 1 milligram per deciliter if they're eating a fairly decent diet. If they're less than 0.6 milligrams per deciliter, they're into a scurvy-type range of vitamin C. But what we're talking about for a post-IVC saturation level, giving, let's say, 25 to 50 grams of vitamin C IV over about a 90-minute period, is something in the 200 to 300 milligram per deciliter range. So we're talking about 200 to 300 times the normal amount of vitamin C that your blood normally experiences just eating a balanced diet.
And these extraordinarily high types of levels are really mostly indicated for the treatment of cancers and infectious disease. Is that correct?
That's right, because when you get into these, as you say, extraordinarily high blood levels, what happens is vitamin C, which will always be an antioxidant, nevertheless starts to have a pro-oxidant effect. And this has been documented at NIH in 2 studies. Matter of fact, at our second annual Reardon IVC and Cancer Conference, we had Dr. K. Chen, who was the author, along with Mark Levine, on high-dose vitamin C as a source for creating hydrogen peroxide in the extracellular space surrounding tumor cells. And it's thought that it's this hydrogen peroxide or pro-oxidant effect of vitamin C that's actually having the anti-tumor property, as well as it's that same pro-oxidant effect that's helping the body get rid of infectious disease.
So, in your experience in using it for these conditions, what are some of the more dramatic examples that you've seen over the last 20 years? I mean, you've as you mentioned earlier, you've given over 60,000 doses of IV vitamin C. So I'm sure in over 20 years you've seen, quite a few dramatic recoveries. Because if there's no way you'd still be doing this over 2 decades if it wasn't effective.
Yeah, Dr. Reardon's very first case was a stage 4 renal cell cancer that had metastasized to the lungs. And basically the oncologist had said, there's nothing else we could do. Go ahead and get your things in order. And that's when the patient had read about Linus Pauling's research. And so he came to Dr. Reardon, and Dr. Reardon went ahead and started giving him, started out with the 15 grams, but he moved him up to 30 grams twice a week. And after 2 years, actually it was after 1 year, the metastases were completely gone. The oncologist called him up and asked him what had he done, because he had never seen a stage 4 cancer go into remission. And we've actually had very good success with renal cell, bladder cancers, and lymphomas. Those types have been very effectively treated with IV vitamin C.
Okay, now I just want to go back to a basic supposition and really address many of the skeptics who will be viewing this and say, I don't believe you. Well, Dr. Linus Pauling actually won 2 Nobel Prizes. One was in science and one was for peace, but he really should have won 3, because he really almost won the Nobel Prize for discovering the DNA, so he should have had 3.
That's right.
I mean, he really was a brilliant man. And he wrote the book about vitamin C, and he was just castigated in the public. And there are many people, scientists, who kind of used a variety of ammunition to discount what he said, even though he was clearly a genius. So I'm wondering, and then if you could comment on why this approach hasn't been adopted. I mean, you've been getting some success. Why hasn't conventional medicine caught on to this? Why aren't they using it more? I mean, what is the limitation, the confounding variables that's preventing people or physicians and clinicians and researchers from adopting this more widely?
Well, I'm sure there's several factors here. Number one, most people think of vitamin C as it's a vitamin, and you define vitamin as a trace amount of a substance that you need to prevent scurvy, for instance, in vitamin C's sake. But what we're talking about here is something in a pharmacologic range. And the way to really understand vitamin C is to go back to the writings of Irwin Stone, who wrote The Healing Factor, which was a fantastic book written in the 70s about vitamin C. And he points out that every creature, when they are sick, they greatly increase their liver or their kidneys' production of vitamin C. Now, humans, primates, and guinea pigs have lost that ability. We lack we still have the gene that makes the L-gluconolactone oxidase enzyme that converts glucose to vitamin C, but it's non-functional. So we have to get our vitamin C from the outside. We have to get it as food. But when we give it IV, in a sense, what we're doing is recreating the liver's ability to synthesize tremendous amounts of vitamin C. Now, I'm not sure how much humans can synthesize. I do know goats, when they are severely injured, can take what would be a normal synthesis of about 2,000 milligrams per day. If you were comparing their weight to an adult human, it'd be about 2 grams a day when they're well, up to as high as 18 to 20 grams a day when they're sick, severely sick or injured or infected or stressed. And so I always look upon high dose vitamin C as nature's way of dealing with crisis in terms of one's health. And so this notion, however, does not exist in the conventional thinking in the medical mind. And my son, who's a second-year medical student, has had very little, if any, discussion of nutritional therapies. The only reason he knows he's had a little bit is because one of Dr. Reardon's students, Dr. Jeannie Driscoll, who is also doing IV vitamin C research, is at the University of Kansas, and there are more people aware of utilizing IV vitamin C for cancer there probably than any other medical school in the country. And so he has heard of it in his medical training. But other than that, there's no other nutritional training that he's gotten so far.
So it's just, I guess, this lack of appreciation that humans have lost the ability to make vitamin C. And if we had that ability, like many animals do, we would generate really high levels under certain conditions where we were exposed to these stressors that required and benefited from the vitamin C. So
right,
is that that's the primary reason? It's just this.
Well, and also, I mean, there are other factors involved here. There are financial factors. I mean, the standard oncology treatments are extremely expensive, and IV vitamin C, relatively speaking, is very inexpensive. And so the notion that something that is non-toxic and that has there's no FDA indication for IV vitamin C. So oncologists are reluctant to use what they consider to be a kind of a pop culture type of approach to cancer because again, cancer is a life-threatening disease. But what they forget is that most cancer patients are depressed, they're in pain, they have tremendous fatigue and depression, and these are all signs of scurvy. And if you actually measure vitamin C levels in cancer patients, especially advanced cancer patients, they're all below that 0.6 milligrams per deciliter level that I was talking about. And so one of the things that IV vitamin C does is that it immediately relieves their scurvy symptoms. And so they start having a greater sense of well-being. Their pain, they don't need as much pain medicine. Their appetite improves. Their mood improves. They have a better quality of life. And this was recently replicated in a Japanese study that was reported on over in Japan at this symposium that I was at, that cancer patients who get IV vitamin C improve quality of life in all the various statistical measures that you can look at.
Okay, so it sounds like another component that really is somewhat obvious if you think about it is the economics of the situation too, and that oral vitamin C is really inexpensive, but it's very few people are be able to go over 10 grams due to bowel tolerance issues, maybe 20 at the most, but so that's going to cost a few dollars. But even IV vitamin C is relatively inexpensive. I mean, when you consider the cost of the traditional oncology patient, and I don't see those patients, and you do, and you could perhaps give us a better idea, but my understanding is that we are talking hundreds of thousands of dollars in typically, I mean, many of these medications are tens of thousands of dollars a month to give to these patients, and that's a massive industry. So there's all these incentives to perpetuate that type of process or intervention because there's massive amounts of profits to be made from people promoting that. Where
that's right.
No one's making money from vitamin C.
That's right.
That's sort of an option.
The way we're trying to position IV vitamin C is that it's an excellent adjunct, and Dr. Chen presented 2 weeks ago at our symposium, and she presented amazing research showing that in pancreatic cancer patients, if you give them just Gemzar alone, which is one of the standards of therapy there is a slight improvement, but nothing very dramatic. Vitamin C alone will show a significant improvement in pancreatic cancer cells in terms of knocking out tumor cells. But if you combine the two, vitamin C and Gemzar together, there is a clear synergistic benefit to the two together. as well as if they gave it to patients, which we know. We had a pancreatic cancer patient survive 2.5 years doing IV vitamin C, and the typical survival time of a standard pancreatic cancer is 3 to 6 months at best.
Probably
And so,
3.
yeah, 3 is more typical if they're lucky. And so, plus the IV vitamin C greatly improves quality of life, reduces side effects from chemotherapy, and does not, I repeat, does not interfere with chemotherapeutic agents, even though that is a common misunderstanding. And that's another reason why oncologists do not normally recommend vitamin C, is they have this idea that the antioxidant effect of it's going to interfere with radiation or chemotherapy.
All right, I'd like to transition into more of the typical consumer questions that we have, because most of this is really more for professional. But on the other hand, between 1 and 2 and 1 and 3 people viewing this are going to be either themselves personally or know someone who has cancer. So it's not an insignificant question, and really understanding that this could be a very helpful therapeutic modality is important to know. So if someone has been inspired and curious to integrate this into either their own cancer program or someone they know or one of their family members, what would you suggest to them to do to acquire more information so they can implement this type of program?
Well, we actually have the Reardon IVC protocol on our website at reardonclinic.org, and so they could go there, and plus we've got all of our research articles on that same website, so they can start looking at the research. I've done a video on how vitamin C fights cancer at healthhunteronline.org that's very good.
And that's spelled just the way it sounds, Health Hunter?
healthhunteronline.org,
okay.
and click on free video, and they can watch a very detailed explanation of how high-dose vitamin C has a pro-oxidant effect and can be very beneficial in treating the cancer patient.
Okay, great. Well, thank you for that, because I'm sure many people are going to be interested in integrating it.
And at that same website, Dr. Glenn Highland, who was an oncologist that's been consulting here at our clinic for several years, did a very nice lecture entitled IVC, Chemotherapy, and Radiation, Are They Compatible? And he does a compelling job of showing that not only are they compatible, but they are synergistic.
Great. Well, that's awesome. So thank you for compiling that and offering those resources. That will be very helpful. So I'd like to focus more to the oral version and what many people do, because it's probably one of the most common supplements that people are using is vitamin C. Now, as you alluded to, many times you're just simply unable to achieve the high levels in the blood that's necessary when you take oral. But there's a new version that I actually learned about first from Dr. Thomas Levy, who's clearly one of the leaders in this area, and that is liposomal vitamin C. And I'm wondering if you can address that, because his experience to me is that you tend to bypass many of the complications of the traditional vitamin C or ascorbic acid and are able to achieve far higher intracellular concentrations that in his case seem to be comparable to the effects of intravenous vitamin C.
Yeah, I've talked to Tom about this at quite some length, and as of yet, I don't see the proof yet. I went ahead and got a case of liposomal vitamin C myself and took my dose up to 34 grams a day using it. And one thing I can tell you is that it's amazingly well tolerated, but it does not raise the blood level all that much. And I've talked to Tom about this, and he says, well, it may not raise the blood level that much, but it does not require the GLUT transporter to get the vitamin C into the cell, so it just passes right on intracellularly. So I'm all in favor of people trying this, and I think it can be used as an adjunct to IV vitamin C, because most people are only going to do IV vitamin C once or twice a week.
Yes.
And so by doing the liposomal vitamin C, they can easily do 6 grams of liposomal vitamin C orally without a bit of gastrointestinal distress.
Yeah, it's interesting to hear your feedback on it. It's certainly more convenient, and not many of us are going to want to enjoy having a needle inserted into one of our veins twice a week. And ascorbic acid can be relatively damaging to the veins. I mean, there's no question. So it's definitely.
No, that's not true. No, but that's not true.
I mean, irritating is what I meant to say.
I've given my wife over 350 IV vitamin C infusions because she had breast cancer about 12 years ago. And I've used the same vein for over 12 years without any difficulty. So you have to make sure that the company that you're getting your vitamin C from has properly buffered it. If ascorbic acid, if it was an acid type of substance, which it could be if they do not buffer it properly, then yes, you could get some damage to the endothelium of the veins.
Okay.
So.
Well, just to finish up the discussion on liposomal, because I didn't really mention what that is for our viewers who have not been exposed to it before, but essentially it's something like an egg yolk where you have this phosphate bond that's attached to the vitamin C, and because of that, you get much better absorption. So that's why you tend not to see the diarrhea that you normally would, because it's not in the gut causing this osmotic diarrhea. So, that's one reason. But, the thought is that once attached to this phosphate, it just really goes straight from the blood into the cells. So that's why you may not see the higher blood values that you did seek to objectively document. But it's interesting to know because you're clearly one of the leaders in the field. From your perspective, it's still somewhat unproven, but certainly not dangerous.
Oh no, I would recommend it. There are other forms of vitamin C out there now that are they're new forms of sodium ascorbate that are buffered that can be I take 12 grams every day first thing in the morning and I have no GI upset. So part of it too, you have to kind of get your gut in shape to vitamin C. And so not everyone needs to take that amount, but high doses of vitamin C does improve your immune system. It supports adrenal function. It's definitely can improve endorphin levels. So there's a lot of benefits to vitamin C just to general health.
Well, I wonder if you can comment now on some of the specifics of the oral forms that are available. There are a number of people, primarily with a naturopathic perspective, who believe that it's not just the pure vitamin C, the ascorbic acid, but it's the combination of the ascorbic acid with its associated micronutrients that one would find in nature, like the bioflavonoids and all the other components. And it's a synergy taken together that's more effective. Now,
there's no question that would be a better way to go. I mean, anytime you can do more like food, you're going to be better off. And I think people sometimes get the mistaken understanding that supplements are better than food, but I think food is still the essential thing that your body needs in order to get optimal cellular functioning. But when you're sick, you can use trace nutrients in orthomolecular doses to achieve effects that you can't get from just food alone. So, but in general, for people who are healthy, who are wanting to stay healthy, I would recommend using vitamin C that's got bioflavonoids and other cofactors associated with it.
Okay. Do you have any specific favorites that you like, or any specific bioflavonoid combinations that you have found useful over the years?
Well, none that I can specifically think of. I mean, I just tell people to eat a really good whole foods, colorful diet, and you're going to get a lot of bioflavonoids that way and carotenoids. The more colors, the better, and that's where you get the phytonutrient synergism that can be very effective in maintaining health and keeping the cell in a balanced state of redox.
Now, one of the other uses of vitamin C, and I want to talk about some of the conditions that you found helpful aside from infections and cancer, would be the indication of bruising or easy bruisability, capillary fragility. And typically that's not just vitamin C, it's the associated bioflavonoids that are useful there. And one of the other conditions and side effects you can have if you have this tendency is you could actually be far more easily predisposed to hemorrhoids, because that's sort of a complication. So they go hand in hand. If you have easy bruising, you're likely going to have an external and internal hemorrhoid. So what have you found to be useful for this therapeutically?
Well, once again, I think we probably put every patient that we see on vitamin C, and I myself in medical school had trouble with hemorrhoids, and until I actually got on vitamin C, I would have bleeding hemorrhoids and bleeding gums. So the top and bottom were bleeding, so that tells you that I was vitamin C deficient all through medical school and through the early years of my practice. But in the last 20 years, my gums don't bleed and I don't have hemorrhoids, and I take a lot of vitamin C.
You take the bioflavonoids too, or?
let's see there. I take grapefruit or grape seed extract regularly, and I usually take quercetin. Uh, but I don't take a bioflavonoid mix per se. Would probably be a good idea, but I don't
Well,
take that.
when I reviewed this for a friend who had this problem, I found that rutin seemed to be particularly
Yeah,
useful.
root would be. I agree. That would be excellent.
And rutin by itself, and not to diminish the importance of the need for vitamin C, but rutin by itself, I think can reverse the bruising and the tendency towards hemorrhoids. So it's just a little
Yeah.
hint that I learned. It seemed to work well for the person I recommended it to.
Now there's an interesting thing about dosing. Mark Levine published a study where he basically said that it does. There's no need to take any more than about 220 milligrams a day vitamin C because it's just going to go out. But Dr. Steve Hickey, who has written a book called Ascorbate, has shown that if you take vitamin C frequently throughout the day, you can achieve much higher plasma levels. So even though the kidneys will tend to rapidly excrete the vitamin C, if you're dosing it every hour or two, you can maintain a much higher plasma level than if you just dose it once a day,
All right.
unless you have an extended release form of vitamin C.
Okay, so that's a good point, and kind of leads me to one of my next questions, which because we have many people who wrote in asking about this, which is ester C, and I'm sure you've got some views on that. So if you can share that with us, we'd
Yeah,
appreciate.
it's a buffered form of vitamin C, and generally, a lot of people who can't tolerate vitamin C, they really can't tolerate ascorbic acid. The ascorbic acid tends to disrupt their gut in such a way that they get gastrointestinal distress. Ester C is better tolerated because it is buffered, and it seems to be that the vitamin C derivatives that are used to make that stay in the bloodstream longer than just straight ascorbic acid.
Well, I had some concerns about ester C, and perhaps you can address them. And just for a basis of understanding for our listeners and viewers, is that vitamin C is an antioxidant because it's an electron donor, and it only is doing that if it's in the reduced state. If it's in the oxidized state, it doesn't really work well. And there's rejuvenators like coenzyme Q10 in the system that will reoxidize it or reduce it so that it can donate electrons again. But my understanding is that most of the ester C is oxidized and not as beneficial, but I'm wondering what your experience has been.
Well, there was a study at Sloan Kettering a couple years ago looking at the effects of dehydroascorbic acid on cancer cells, and it was a negative study. And basically, to me, it was a big duh. I mean, I would not use an oxidized form of vitamin C. Now, the idea that ester C is an oxidized form of vitamin C is new information to me. I did not know that.
Yeah, that was my.
So,
That's why I've always avoided it and discouraged people from using it. So, and that could be mistaken, but that's my current understanding. And
I would not recommend using oxidized form of vitamin C, much in the same way with CoQ10, the new ubiquinol, which is the reduced form, appears to be more effective at the cellular level than the oxidized form, unless you're a young person and have a really active uh, ability to regenerate your antioxidants.
so yeah, sometimes the devil's in the details. There's no question
Yeah, no question.
about that. So, do you find are there any ages or concerns with ages giving vitamin C? Like, would you give it to a newborn or an infant? Obviously, it would be not an oral version, something they would chew or swallow or drink.
No. Dr. Klenner, who was a pioneer in vitamin C, used to give his pregnant mothers 3 to 6 grams a day, and so my daughter, who just had our first grandchild about 14 months ago, I think she took 4 or 5 grams a day and had a very easy delivery, and she's continued to give her daughter at least 250 to 500 milligrams per day. I would strongly encourage it. Most pediatricians accept the fact that babies will have 8 to 10 upper respiratory infections in the first year of life. Well, that's true if they are low in vitamin C, but if you give them adequate vitamin C and vitamin D and a couple of these other nutrients, the kids just don't get sick And this has been true for our granddaughter. She's been in a daycare setting and she's been the only one I think she's had one upper respiratory infection in 14 months.
Yeah, I might add that there's probably a powerful synergy with which is the new craze vitamin, which is vitamin D, and thankfully it's gotten more recognition. Really, it truly is not a vitamin, of course, because vitamin is really reserved for the terms that we can
Right.
only get from our diet, and we can clearly get vitamin D from exposing our skin to sunshine, a proper amount of sunshine. So
Right.
but vitamin D has many similar benefits, and when you combine that with therapeutic levels of D and vitamin C, you really make it very difficult to get sick.
Yeah.
Which is which,
I've had many patients in the last year say they've been through the winter months without getting ill, and it's been over and knock on wood, it's been over 2 years since I've had a respiratory infection.
yeah,
So,
and it just as another an aside, but I think an important comment, and certainly I'd like you to address this too, because you have a lot more experience in this, which your focus on cancer. But it's my personal belief that if you have a proper lifestyle, you avoid most of the toxins, are exercising properly, you have optimized vitamin D levels, optimized vitamin C levels, or taking regular amounts of it, and really pretty much eating a healthy diet, staying away from the bad stuff, that processed foods and other components, that it's very, very unlikely you're going to come down with cancer. That you essentially, by following this type of lifestyle, you immunize yourself against well over 90%, maybe over 95% of potential malignancies.
in the symposium that I just came from, the one we had 2 weeks ago, we talked a lot about cancer being the non-healing wound, and this is a new concept and what cancer is. And most people think of cancer as something from the outside that has taking over the body, and kind of the invasion of the body snatcher type thing. But in reality, it appears that cancer is a maladaptive response to sustained injury. And if you take any area of the body and injure it with toxins, radiation, you name it, and the body attempts to heal that wound but runs out of healing resources, then that wound will start to turn cancerous. The non-healing wound will start to turn cancerous, and it turns out that cancer may itself be the healing process maladapting to a nutrient deficient situation.
Well, I
So
love that perspective. So, what level of immunity do you think it would provide if you had an optimized lifestyle? I mean, how much do you think it would reduce your risk of anything? I know it's just a guess, but your guess is better than mine because you see this all the time.
well, Roger Williams, Dr. Roger Williams, the great nutritionist researcher, basically said that the environment of the cell can always be improved, which means that any of us, all of us, could do a little bit better at any given time. But if you're really working from an optimal state where you've got all your nutrient levels optimized, you've got your toxic levels reduced as much as possible, you're getting exercise and sleep, and just coming from Japan, there's a term that I learned called ikigai. Ikigai. Ikigai means your purpose for living. If you've got a strong ikigai, I don't think you're going to be nearly as likely to get cancer as someone who's malnourished, leading a absurd existence, not getting enough sleep, exposing themselves to toxins. A lot of our toxins are self-exposed toxins. I think those people are going to be at a much higher risk for cancer compared to someone who's taking good care of
Well,
themselves.
just that's what I was trying to get number wise. Do you think it might be as much as a 90% reduction in the likelihood? Because it's all a matter of
I,
numbers.
I, I, I would like to think so. I mean, I know my whole reason for being in this field is so I could learn how to take better care of myself and my family. And I'm not planning on getting cancer, but I do see patients who think they're doing everything right and they still get cancer. So that's why we do encourage nutrient testing and various ways to assess your state, because you do need reality checks, because
Yes.
sometimes people think they're doing good, but they're not doing as good as
Well, and
they.
another common reality check that is really there's virtually no way to know, you can't perceive this, is your vitamin D level. And we
Right,
know
you've
that if
got to do blood levels on that.
there's just you
Absolutely.
just don't know, and even though you think you're taking swallowing enough, even maybe 5,000 units, there are people that I've seen, I'm sure you've seen too, who need 20, 30,000 units a day,
Right.
or 2 hours of exposure to sunshine, or a combination of something. So you got to get up there, and if you're treating cancer, you probably want to get closer to 80 to 100 nanograms per milliliter to treat that effectively rather than the 50. So it's a very powerful thing, and I'm
Yeah.
glad you brought up
I agree
that
with
point.
that. And
And
that's where, Dr. Reardon, my boss, who started our clinic, he basically said the big missing piece in nutritional medicine was the use of the lab to verify optimal levels.
yeah.
If you now, not everyone's going to have the resources to do that, but if you can periodically get tested, that's going to give you. I mean, to me, that's probably one of your best way. I look upon nutrient levels as kind of tumor markers. If you've got good nutrient, if you've got a very good vitamin D level, that's as good as having a low tumor marker.
Yeah, and let me just go off on another little tangent here because I mentioned the vitamin D level, but during my lectures, there's a few other simple tests that can be done. That is to check for iron or ferritin, and
Yeah.
ideally
Yeah.
should be between 20 and 80 because I'm sure you've seen and experienced what I have is as many as 20% of the people out there have elevated iron levels, which will
Right.
increase your risk of
That's
cancer.
that's
And
exactly right.
and you don't need to take a supplement for it. All you need to do is donate your blood. It's the most effective way, a therapeutic phlebotomy, and you can radically reduce and eliminate that risk factor. So a ferritin level, insulin level, that tells you if your diet is appropriate, if you're exercising and you're eating the right amount of protein, carbs, and fats, and your insulin receptor sensitivity is another huge risk. So those was three simple tests.
Actually, actually, Joe, the people that go in and see their cardiologist and get lipid levels and blood sugar levels, all the risk factors for heart disease are very similar to the risk factors for cancer. So if you've got an elevated glucose, uh, elevated lipids, and an elevated CRP, we think the CRP is a pretty good tumor marker. And so those are things you need to work on and work on your level of inflammation. There's a really nice new book out now called Anti-Cancer by Dr. David Sargon Schreiber. And he has a beautiful chapter on how what you eat modulates your level of inflammation. And so just for people becoming aware of their CRP and learning how to eat better and take better care of themselves in order to lower the CRP, that can make a huge difference right there.
Yeah, and in addition to cancer and heart disease, there's two other diseases that the same indicators will give you risk factors for, which is diabetes. 1 in 4 people have it. And the upcoming epidemic, which is losing your brain and your mind, which is Alzheimer's. And the projections are 1 in 3 people will have that in the next few decades. So,
And all four of those major disease categories are related to excessive inflammation. And I wrote a little book on inflammation, which basically showed that the major factor that's causing an excessive inflammation in modern times is the diet. The modern diet is 20 times more inflammatory than the hunter-gatherer type diet.
so that's clearly a key indication. And, another element that I think has not gotten a lot of press, but I'm really recently exploring and really haven't talked about it too much on the site is something called earthing, where you're grounding yourself to the earth, either ideally when you're sleeping or certainly in your work environment, because then the earth is able to pass these free electrons and get rid of that inflammation. And Dr. Steven Sinatra, who's probably the leading natural cardiologist in the country, has done a lot of work in this area and has actually shown it massively improves platelet aggregation and decreases the blood clotting, limits the blood clotting, or optimizes the blood clotting ability of the blood, which is why most people have strokes and heart attacks, is because they get a blood clot, which is related to the inflammation. So a lot of basic things, and I think I'm beginning. I know what your experiences with earthing, but personally, I've been using it for a while, and I've known about it for about 5-6 years, but I recently became convinced that it's valid, and my concerns about sort of using it as an antenna for gathering negative EMFs were not valid, and we're going to be recommending it in the near future.
Yeah, I think it's a good idea. The other thing that's come up in the whole IV vitamin C arena is that one of the causes for cancer is decreased oxygen utilization. And it's interesting to me that that a lot of the therapies that are used for cancer actually are using oxidants, intracellular oxidants, because vitamin C at high dosages creates more of the hydroxyl radical. Dr. Frank Schellenberger is using ozone therapy as a treatment for cancer patients. He has developed a way of measuring ATP utilization, and he says every cancer patient he's checked has very low ATP levels. And so when you use an oxidant, you improve your transformation of NADH to NAD. And NAD is absolutely necessary at the cellular level in order to make ATP. And if you have adequate amounts of ATP, then your cells can generate the antioxidant enzymes that you need to control the excessive oxidation that sets up the inflammatory response and the whole cascade of events that lead towards cancer. So things like exercise or anything, or exercise with oxygen therapy, anything that can improve your utilization of oxygen may be actually an anti-cancer approach.
Excellent. So one of the other areas that people believe there may be an indication for and are actually using it, and I wonder if you can comment on this, is the use of IV vitamin C or oral vitamin C to chelate out heavy metals or for detoxing. And what is your experience with that?
Yeah, well, this is pretty well covered in Dr. Levy's book, Curing the Incurable. He covers about 10 different major toxins that vitamin C will help to neutralize. And in my talk on the IV vitamin C protocol for cancer patients, remember that I mentioned that cancer is due to sustained injury. Well, if you've got to remove the cause, if you hope to get over the cancer. And so very often heavy metal toxicity is a major cause of cancer. It reduces ATP formation. It interferes with enzyme functioning within cells. So if you can remove, the other big thing we're finding out is that heavy metals reduce your body's ability to spontaneously generate adult stem cells. So if you want to promote healing within the body, you have to do everything you can to detoxify. And so IV vitamin C is a mild chelator, as well as it helps your detoxification systems in the body and restores glutathione functioning and things like that.
Excellent. I recently met a surgical oncologist who works out of Washington, D.C., who was using infrared saunas in conjunction with, interestingly, a high dose of niacin to serve as a lipolysis, because most of the toxins are stored in the fat.
No, I agree with that.
About 100 to 1. And he was doing pre and post fat biopsies to monitor the effectiveness. He was seeing extraordinary results. He actually had an $8 million grant from the Department of Defense to treat Gulf War veterans and 9/11 victims, and was seeing really impressive results. But so I think that would be another component. And so he used the high dose niacin up to 5 grams, working up slow, with the sauna, and actually exercising before to stimulate the lymphatics and get it out. So it was seeing pretty impressive results. So
I agree. Yeah, if you're going to treat cancer, you can't rely upon one modality. Even though we do kind of focus on IV vitamin C at our clinic, we basically are measuring nutrient levels. We're having people re-examine what they're eating. We're encouraging detoxification strategies, regular exercise, adequate sleep, improving interpersonal relationships. All of this can have a bearing on your outcome in cancer.
Great. And I guess, a real common one that traditionally, of course, people have used vitamin C is for the common cold. I've been promoting high-dose vitamin D, if you haven't been using it before, as a one-time dose, but I just think a combination will be good. So, what are your most effective strategies for incorporating vitamin C? From what you mentioned earlier, it sounds like an every hour use of the vitamin C supplement would be useful if you can integrate that into your lifestyle, but rather than taking one dose once a day or even twice a day, you're going to get better results if you have a lower dose more frequently.
yeah, you're going to get higher sustained blood levels. And if you're starting to come down with a cold, then I would recommend anywhere from 1 to 4 grams every hour until you get, loose stools. And very often you can head off a cold that way. And then I also use 50,000 units of vitamin D3, one or once or twice a day for a couple days if you want to try to stop a cold in its tracks.
Yeah, the earlier you start, the better, I'm sure. Do you find that those doses that it makes any difference if you're using a vitamin C with bioflavonoids or a powder that you would put in, or if the type of powder like sodium ascorbate versus some of the other mineral ascorbates may make a difference?
Dr. Gary Gordon has come up with what he calls a tightly bound sodium ascorbate powder that incorporates some D-ribose and MSM. And I've been using a lot of that lately, and I've found that people can take a lot more of it than they can regular buffered C or ascorbic acid. But it's more expensive.
Hmm.
I think ascorbic acid is fine if you put it, if you have to put it in a little bit of water with a little bit of juice in it, and that'll cut the taste. And as long as it doesn't upset your stomach, if you do a small amount frequently, you should be fine.
With the juice, like a lemon from a lemon or a lime, which you have much less
Yeah,
fructose and
right.
so
That'd be the best way to do it. Yeah.
would
Yeah.
buffer it essentially?
Yeah, it will to a certain extent. Yeah, it will to a certain extent. Yeah.
Okay. Yeah, I like lemon and limes. In fact, it's sort of our trick for using vegetable juice, which is another powerful intervention, just juicing vegetables, because we all need, 5, 6, 7 servings of vegetables a day. And how many of us are doing that? So if you integrate a vegetable juice into your program, you can do that. But the lime makes a huge, or a lemon makes a huge difference in making it palatable.
Right. Right. I think that's a great idea.
So,
Dr. Abram Hoffer, who was Dr. Reardon's good friend, actually did a thing with I don't know, it was up to 1,000 patients. This was years ago, where he had them go up to as high of an amount of vitamin C as they could take, niacin, B complex, selenium, vitamin E, and vitamin D. And this oral program, he found, dramatically improved survivability in cancer patients.
excellent.
So some of these oral synergisms, like I call it redox synergy, if you use these things together, you're going to get a lot better effects than if you use just one thing alone.
Yeah, so a lot of times, what I've noticed after 3 decades in health is that the more you know and really understand about the truth of the matter, it's pretty simple. It's back to the basics. It's not rocket science, and that's very encouraging for those who are listening, because it really empowers us to understand that we can, as a consumer, as a patient who didn't go to medical school, really take control of our health and integrating these very simple and most of the time inexpensive and virtually in most cases without side effects
That's
treatments
right.
that can
That's
that
right.
can have radical improvements in your health, that you don't have to rely on these dangerous and expensive medications that can wipe you out prematurely. So
I've often told patients that your cells really don't care what diagnosis the doctor is giving the problem. They only want to make sure they have the key nutrients that they need to run the metabolism that cells have, and then they want to make sure that the toxins that interfere, the anti-nutrients that interfere with their functioning, get those out. And if you do those two things, you can achieve a very high level of health.
well, I'm glad we're in agreement with that, because it seems to make a lot of sense. So I guess we're at the end of the interview, and if you just want to make any closing comments and emphasize any key points, and then we'll additionally ask for specific follow-up information or content information if someone wants to find what you're doing and more about you.
Okay, yeah, I just to let people know that intravenous vitamin C, in my mind, is the rediscovery of an innate healing ability that all organisms use when they're stressed, sick, infected, or injured. And IV vitamin C has been used in burn patients. It's been used in chronic infection patients. It's been used for depression. There's just so many things that respond well to intravenous vitamin C. This is for people that have a serious illness. Now, if you're well and you want to stay well, you don't have to do IV vitamin C. You can, though I do have a friend of mine in Japan who every sibling. I think he's got like 8 siblings, and they all have cancer. He's doing a 25-gram IV vitamin C every week to prevent the cancer that everyone else in his family seems to be getting. So you can use it preventatively, though I think good lifestyle, good habits of health, good nutrition works just as well if you can stay well that way. But if you do get sick, it's a very powerful tool that I think is underutilized by most doctors.
Okay, great. And again, if you can highlight the resources that people could obtain more information or learn about you and what you're doing in your clinic.
Well, the Reardon Clinic has a very nice website, and then if you click under research, there's 2 pathways you can go down. One, it has all of our research articles that we've published, over 100 different articles that we've published. And then on the other side of it, it has the Reardon IVC protocol and some basic information and videos about the RECNAC research project that was undertaken in the 90s that is very helpful to people. And then the other resource is the healthhunteronline.org, and you click on videos, and there's one called How Vitamin C Fights Cancer. That's me talking about the mechanism of how it works. And then the other one is Dr. Glenn Highland, IVC, chemotherapy, radiation, are they compatible? Where he gives a very compelling lecture to a group of scientists about how not only are they compatible, but they are synergistic and improve quality of life.
Well, I thank you for those resources. I thank you for your time today and helping us better understand this really powerful resource that we can easily incorporate into our lifestyle and use more aggressively if serious illness does develop, to a very good benefit for anyone seeking to apply that. So thank you again, and best of luck with your work out there.
And thank you, Joe, for all the work you do to get this message out.